Also happening now, there are new questions about President Trump's health after he told the Wall Street Journal he takes a higher daily dose of aspirin than his doctors advise and blamed that for the bruises on his hands. The president said, and I'm quoting him now, "They say aspirin is good for thinning out the blood, and I don't want thick blood pouring through my heart. They'd rather have me take the smaller one. I take the larger one. What it does do is it causes bruising," end quote. At 79 years old, President Trump is the oldest president to take the oath of office. White House Press Secretary Caroline Leavitt tells CNN he, quote, "continues to be the most transparent and open president in history and has nothing to hide," end quote. Joining us now to discuss all of this and more, Dr. Jane Morgan. She's a cardiologist and the Vice President of Medical Affairs at Hello Heart, which seeks to improve Americans' heart health. Doctor, thank you so much for joining us. So here's the question about the aspirin that he's taking. Can 325 milligrams of aspirin daily cause bruising like we've seen on President Trump's hands?
And you know what, Wolf, it can. What we have to remember about aspirin is that we used to use it for primary prevention, meaning to prevent a first heart attack or first stroke. But now we know that it's really better for secondary prevention, meaning preventing recurrent events, recurrent heart attacks. And so using it as primary prevention is not really the best method of how we're utilizing aspirin. We also know from many research studies that 81 milligrams is really the best dose, because beyond that, there is no greater efficacy, meaning it doesn't work better, but it does increase all of the side effects of aspirin, such as bleeding. So you get no further benefit by quadrupling your dose to a standard adult dose, which is 325 milligrams.
And that's why a lot of cardiologists recommend that elderly people especially take what's called that baby aspirin, 81 milligrams, as opposed to the much larger regular aspirin, right?
That is absolutely correct. And we know, especially beyond the age of 60, aging sort of catches up with all of us, and you can get fragility, fragile capillaries, especially in your hands, in your forearms, thinning of the skin, loss of collagen that supports all of those capillaries. And then on top of that, if you are taking quadruple the dose of aspirin, you can end up with what we call senile purpura or actinic purpura, meaning purple patches commonly seen on the dorsal surfaces of your hands, meaning the back of your hands, and also on your forearms. Often patients will think that if one dose is good for me, if I double it, it must be twice as good. And we see this a lot. And even though this is quadruple the dose that is recommended, baby aspirin is recommended at 81 milligrams, adult dose is 325 milligrams, you do not get quadruple the effects. You get an increase in side effects, but not in the benefits. There is no benefit beyond the 81 milligrams.
Yeah, that's what I've heard from cardiologists myself. And Dr. Jonathan Reiner, who was former Vice President Dick Cheney's longtime cardiologist, told CNN that it's uncommon to see the sort of bruising on President Trump's hands from one aspirin a day. Is it possible that the president is taking other medications that could further contribute to the bruising that has not been disclosed by the White House?
And it's certainly possible. And Dr. Reiner is a great friend of mine. And it certainly is possible that he's taking any number of medications. We have to remember he's almost 80 years old. And so any number of chronic medical conditions could be going on that have not been disclosed. I know he spoke about MRIs and CAT scans and that type of thing. And it denotes the thought that an MRI is perhaps a more serious test than a CAT scan. But when we look at cardiology, a CT angiogram, which is a type of CAT scan, high resolution, produces 3D images, really looking at the coronary arteries, meaning the arteries that feed the heart. This is a very highly specialized CAT scan for the heart. It gives us an idea of non-obstructive or obstructed disease, meaning oxygen and blood feeding the heart. And so certainly when he talks about a CAT scan, it's very vague as to what type of CAT scan that may have been.
Important points indeed, Dr. Jane Morgan. Thanks so much for joining us.
Thank you, Wolf.